So one of the things I think it's, we are talking about, these are a lot of important points about how to incorporate, or if you already incorporate, how to increase the footprint of endoscopic spine surgery in your practice. And I think a lot of us who are, not necessarily endo curious, but have stepped into the field, are always thinking about how do we increase the imprint of endoscopic spine surgery or footprint of endoscopic spine surgery in our practice. One of the worries I feel is what you mentioned, is that what happened, on general surgery side, that now you have difficulty finding surgeons who can open abdominal surgery. That is one of the worries I have, is that usually most technologies go through that curve where they're adopted and then they're overused, and then they start flattening out that curve, and then eventually potentially lead to a period where they're optimally used. So I think we kind of are on that curve, but we are on that upswing. I think a lot more people are adopting it, and my worry is that it would get overutilized to some extent. I think with because of two reasons. One, more surgeons trying to do endoscopic spine surgery for one reason, and the other reason being more patients expecting that kind of surgery. I think so one of the things I think about is, would this lead to more surgeries which are eventually thought of as unnecessary spine surgeries?
Great question. So I think, yeah. So that's quite a possibility, right? So any new technology which comes in, which is more likely to be used as a marketing campaign.
Yeah.
Okay. Can lead to a lot of patients, believing in that.
Yeah.
And sometimes that belief that I think I can be helped with this surgery leads to consultations with surgeons. And if the surgeon is a endo-curious surgeon wanting to do that, sometimes can lead to mismatch of expectations from both sides. If the surgeons is not done that enough, he doesn't know if he will be able to achieve those objectives, and if those achievement of objectives is going to lead to a long-term good outcome or pain relief. He's not really sure about it.
Yeah.
He is taking a leap of faith, and so is the patient. And sometimes that may lead to mismatch of expectation and maybe a not great result, and not a great review for the endoscopic spine surgery.
Yeah.
So I think that fear is always there.
Yeah.
And I think all morally conscious and people with high moral compass, and most of the surgeons are, I think that serves as a much of a inhibiting factors. Like they're on checks before doing that for the patient. So I think, but there are also mechanisms there. What I see is that there a lot of these surgeons, I think, are signing up for a lot of those cadaveric sessions.
Yeah.
Okay, reorienting them with the anatomy. They are practicing quite a bit, and they know which cases are the cases that they should do in their early process of adoption, and not to venture into big cases. And there are a lot of ways that they can be mentored by other surgeons too.
Yeah.
And I think a lot of this industry who is supporting the endoscopic spine surgery also has a lot of mentorships available, and I think there are a lot of fellowships programs that have come across US which are doing endoscopic spine surgery. But I understand that concern whenever technology is new and when there is a lot of hype and everybody has their expectation heightened up that this is going to be the cure, and there's also a hype among surgeons to know it and use it and be on the endoscopic train, and sometimes mismatch of expectations or failure are going to happen.
Yeah.
Okay, but I think the structure is still getting in place.
Yeah.
People are still getting trained.
Yeah.
And I think we'll be beyond it where it becomes a routine norm for it. I think this worry is very genuine.
Yeah.
But I think the solutions have been worked upon too, and this happens with any technology that comes.
Yeah, I mean, I think you're right. I think just because we are concerned about that, it does not mean that we disregard the positives that we can bring for our patients by incorporating endoscopic spine surgery. I think now there is enough evidence uh, we have in the literature, and not just that, we have seen ourselves in our own patient population what are the benefits of doing endoscopic spine surgery. So I think the technology is good. You always have to be on your toes to try and not overuse the technology, not use it in situations where it's not ideal, but at the same time, not let that worry cloud your judgment and underuse a good new technology like endoscopic spine surgery.